Well, I'm still Simone Passarelli. I'm presenting on behalf of my colleague Ramya Ambikapati, who couldn't be here. And this analysis compares men's and women's knowledge of nutrition and looks at how it impacts household, women's, and children's dietary diversity. This study was conducted as part of an ongoing cluster randomized trial in Ethiopia, where chickens were distributed to small-scale farmers. Along with behavior change communication, we also have a comparison arm. And as you can see, there are several different pathways by which both men's and women's nutrition knowledge could impact dietary diversity. And what we see in these three graphs is that men and women's knowledge is equally important for dietary diversity. So come see 47.
So I'm particularly speaking to the agricultural policy people out there, or the agricultural economists. This is a team piece led by Helen Walls at the London School. Do agricultural input subsidies have an impact on nutrition? We did a systematic review. We started out with 1,500 papers. We ended up with four papers. All of them had evidence that said that there were positive impacts, but only 3 looked at the pathways. And the 3 that looked at the pathways said it was all through increases in household income. But of those, 2 said it was through a change in food consumption. The third one said it was not food consumption, it was other spending, particularly on health. So the conclusion is agricultural input subsidies, really popular, really in fashion, but there is no evidence. Thank you.
We did the linkage between soil and serum zinc in children in Ethiopia. So we mainly work this one to identify the number of zinc deficient children could be reached through adding zinc into fertilizer, and for this we interpolated our serum data to the whole country, and we combine our serum zinc status and soil data, and we found some positive correlation between soil zinc and serum zinc. Further, we identified that at the country level, about 4 million children were zinc deficient. Of them, about 1 million of children live in low zinc soil, and only 0.2 million children were living in a very zinc deficient soil, which suggesting that there should be a combined way of intervention needed to overcome zinc deficiency in Ethiopia, and can come to this.
Hello everyone, my name is Sylvia from Milry, and I'm going to talk about milk. So in Kenya, 80% of the milk is sold as raw on what we call the informal markets. So the informal markets give jobs to many and are the source of affordable milk to many. But also, obviously, raw milk is also associated with public health implications. The government of Kenya has been struggling to find approaches that will protect the public from health risks while protecting the markets. 10 years ago, they launched an intervention, a training and certification of traders that was aiming at that, improving food safety as a pathway to inclusive legitimization of traders in the informal markets. 10 years after, we went to see what had happened. We went to talk to the traders, those that have gone through and that didn't, and we wanted to compare benefits, opportunities, and did it really make a difference. So all the results in poster number 5. Thank you.
I led a systematic review to define and categorize food as healthy or unhealthy. And we systematically searched 5 different databases, and reviewers screened about 1,280 abstracts, and all papers included were quality assessed. And the results indicate that there are 3 major approaches for categorizing and defining food as healthy or unhealthy. And in our conclusions, we identified a nutrient-based approach to be more reliable, quantitative, transparent in categorizing food as healthy or unhealthy. For more information, please visit stand 1. Thank you.
Our study was part of a broader study that was looking at the barriers and facilitators to the consumption of milk and dairy products among women of reproductive age and children under 5, funded by the Bill and Melinda Gates Foundation and DFID. So what we did was we realized that the supply chain for milk and dairy products in the informal milk market had been inadequately studied. So we used a snowballing technique to identify all the actors, and we determined GPS coordinates and all the suppliers for the dairy chain. So what we realized was that there are 5 main actors. There was a gender role. Most of the producers were male, whilst the processors and vendors were female. We also realized that the milk was coming from as near as Kaswa to as far away as Kwando. So there is a gender role, and we think that policymakers should look at that in developing policies to increase accessibility and consumption of milk. Poster 6, thank you.
I am making a bold claim that this is the only work which actually looked into, quantified the extent of dietary gaps. I'm not surprised if that happens to be the case by the end of this meeting. What did I want to say? The reason is that you need good data to begin with. Secondly, you also need country-specific dietary guidelines. And then it doesn't exist in most cases, but we think that we have overcome this challenge, and then we have interesting results to share. This gives you the flavor, but the main results are on the poster. Please come and see us.
So as important as rice is, and some of you might not know, but rice fields actually generate a large number of mosquitoes in Africa, and especially the most efficient malaria vector. But in many studies before the early 2000s, a phenomenon called the Paddy's paradox is seen, where malaria risk in humans is actually unaffected or lowered in rice farming communities. One of the hypotheses to explain this is that rice farmers are richer and therefore have better socioeconomic conditions and better access to bed nets and anti-malarial drugs, and therefore are more protected against malaria. But we think that since there's been such a large scale up of interventions, we think that the inequity is no longer true. So is the Paddy's paradox still true? Come and take a look at our poster. And remember, number 11 is like chopsticks, and that's what I use to eat rice.
Malnutrition in early childhood has severe long-term physical and economic costs. The causes of low-quality diets in young children are not well understood. So in this paper, we merged demographic and health survey data on child diet with household wealth, community characteristics, and agroecological conditions to identify the determinants of dietary diversity among children 6 to 23 months from 39 developing countries. We use OLS to estimate a multi-level model of child dietary diversity by age, and we find that child's diets follow Bennett's law. Household access to markets is associated with higher child dietary diversity only at older ages, 12 to 23 months. In contrast, maternal access to health services is associated with improved child feeding practices in early infancy. And we also find that climate change could influence malnutrition. And these results yield important insights for dietary diversification strategies. And for more information, please drop by poster 13.
And CCAFS has been one of the major proponents of what is called climate-smart agriculture. But this poster, what we're arguing is that climate-smart agriculture really needs to broaden its thinking and take into consideration climate-smart food systems. So more information is on poster 15, but I just want to describe the main diagram a little bit. So when we focus only on climate-smart agriculture, it's all mostly at the production side. Some of it also involves policies and things like that. But what we want to say is that along the system, some of that climate smartness might fade away due to things like food miles, unhealthy diets, and things like that. And there are also opportunities along the food system to add in more climate smartness in order to achieve the 3 pillars of climate smart agriculture. And it also links to nutrition.
Who cares about the effects of illicit financial outflows, political stability or instability, and irrigation capacity on nutrition outcome in West Africa? Okay, what we did was to look at nutrition outcome as proportion of people undernourished, illicit financial outflow as hot money outflow, and trade misinformation were used. Average irrigation capacity as percentage of farmland irrigated. The important thing is that the irrigation model is significant and could explain as more as 70% of the outcomes of malnutrition in Africa. So what is the work saying? That all people and governments should try to revert all illicit funds outside Africa into Africa to develop agriculture, and then malnutrition could stop. But what about other people, so the other variables like irrigation capacity, political instability, and estimation techniques? Please meet me at.
And I used household survey data representative of the Feed the Future Zone of Influence in Bangladesh to look at the relationship between household involvement in fish and shrimp farming and their average per adult equivalent fish consumption, both in the aggregate and broken down into large and small fish species. This came out of some questions in the literature about whether people are substituting smaller, more nutritious per gram fish species for larger species commonly grown in aquaculture. I found that there was higher large and small fish species consumption among households involved in fish and shrimp farming. And I also looked at other sociodemographic characteristics in the household and found that female caregivers' education was positively associated with higher levels of fish consumption as well. For more information on the other results, you can come see me with comments or questions at 23. Thank you.
My name is Elise Talsma from Wageningen University in the Netherlands. And I want to ask you, how do you measure healthy diets? We talk about it a lot. Or quality diets. So we all want to know more about this and use it. But we all do it differently, isn't it? So there are a variety of indices out there covering all kinds of aspects of diet quality. So to find out what kind of quality diet indices exist, we did a systematic review. And if you want to know more about outcomes and the recommendations that we made, come and see me at 59.
We use dynamic generalized method of movement estimation to understand the relationship between governance quality, migration, and to isolate their impact on food and nutrition security in sub-Saharan Africa. We know governance quality is a crucial factor in addressing food and nutrition security in Africa. We use panel data from FASTAT, then World Development Indicator and World Governance Indicator for 15 countries in sub-Saharan Africa from 1996 to 2015. Then research shows that governance indicators has impact on nutrition security, but not on food security. However, control over corruption among the indicators of governance had impact on food and nutrition security.
I'm going to be presenting findings on social and physical drivers of food choice in a sample of urban Ghanaian women. For this, we used an exciting and innovative participatory photo voice methodology in which we ask women to take photographs of things that influence what they eat. And we then conducted in-depth interviews with them for them to be able to share their stories with us. Three main themes emerged from the analysis. The first one was food safety, and that included environmental sanitation, food hygiene, as well as the concern that women had around food adulteration and contamination. The second theme within the physical environment was the financial access, which was a barrier to eating healthy or well. And finally, the third theme that was really important within the social environment was the family and also the relationship that women have with the food vendors in terms of the type of services that they can get from them. So, for example, the services. Thank you.
There's a surge of interest in school gardens in developing countries. The only problem is that there's no evidence for impact on nutritional outcomes. This SDC-funded project tested the school gardens in 3 countries, Nepal, Bhutan, and Burkina Faso. We used a cluster randomized controlled trial, repeated it for 2 years, and had a sample of over 6,000 school children. The results show that school gardens are generally have effective on increasing the knowledge and the preference of children towards healthier diets. However, we did not find convincing evidence for positive behavioral change to consuming more vegetables and fruits. Not everything is lost because we're trying a new intervention design supported by the Drivers of Food Choice project, and we are positive that it will change, maybe change the results. If you still have no clue, come to poster 52 and I'll explain you.
Yeah, from 4G fertilizer, the map you see depicts 3 messages. Message 1 is about the spatial variability of soil zinc, that is crop available zinc. The blue area you can see these are the sufficient in zinc. The red areas these are deficient in zinc. So you can imagine about that. Zinc can not only enhance crop yield, but it also, if it is lacking in soil, farmers would be harvesting nutrient deficient crops. The second message from this map is that this map communicates uncertainties to the decision makers. For example, for blue areas, we are sure that there is soil are deficient even if the sample location are not sampled there. But in case of gray areas, we need to visit the field and collect soil samples. So these are analysis, and all the work is done by Fauji Fertilizer Company, a private sector entity, doing all this free of cost across the country for the last 30 years. So this shows the power of and the value of the private sector for interaction with the decision maker. We are also investing $2.5 billion in Tanzania to invest fertilizers.
We have two research questions to answer. The nutrient sensitivity to price changes and income changes among Tanzanian households. We have two main contributions to the literature. The first one, we use a state-of-the-art large demand estimation model to address these questions. And then two, we shed light on the pro-nutrient price and income policies by providing potentially effective food groups to improve nutrients based on consumers' actual preferences. Now, what's my favorite number from now on is 53.
We did a study in rural Malawi comparing individual dietary diversity and household dietary diversity. Our contribution is towards the measurement issues as a way of trying to validate the measures as well as its conceptualization. We asked the individuals that were responsible for food preparation in the house on what foods they have been eating, and then we also ask them about highly processed foods, if they are included in their diets. What we have found is that seasonality exists in the diets with a high reported dietary diversity during peak periods relative to the lean periods, but also the women are disadvantaged, especially for food groups like fish and seafoods. They eat less of that. But also there are highly processed foods in the diets, oils and fats especially, and as well as spices, condiments, and beverages. We also noted that markets are very key to support the...
Okay. We started our research with an assessment of the nutritional and agrobiodiversity situation in Vihiga County, Western Kenya. Afterwards, we discussed the results with the communities there and encouraged them to develop their own activities to improve nutrition. The communities came up with poultry keeping and kitchen gardening. And on the picture on the left, you see them developing community action plans to describe how they want to realize the activities. Before they implemented it, we did a nutrition baseline survey, and the implementation was supported through agriculture trainings and nutrition education, which you can see on the other two pictures. So after 1 year of implementation, we did a nutrition endline survey, and impact study showed that dietary diversity and also partly micronutrient adequacy of women and small children significantly increased through the activities. Poster 10. Thank you.
Malnutrition is a big issue all over Mozambique, but especially in the northern provinces. And even though there's actually not the highest food security in the north, there's still this high malnutrition. So one of the main government responses until now has been to really focus on behaviour change in these provinces. We use dietary modelling using the cost of diet tool to work out how much or estimate how much it would actually cost to meet nutrient requirements for a family of 5 across the 10 different provinces of Mozambique in urban and rural areas across 4 seasons. And we found that across the country, the cost of a diet that met nutrient requirements for this 5 people in the household was between $33 to $74, which was about 6 times as expensive as it would be to just meet energy requirements. We then can see that the most expensive household member to meet requirements for is the adolescent girl. We then worked out that only 73% of the population in the north could actually afford this diet. And if you'd like to see what the effects of nutrition interventions might be on this affordability, come to 29.
My study is feasibility of farming system for nutrition under LANSA. Farming system means increase the productivity of nutrient-dense crops like millets, pulses, fruits and vegetables, along with the nutritional awareness. Main objective of this study is improving dietary diversity. We find a improvement in dietary diversity in household level, and household level. Quantity of intake also improved at household level. Please, more details of our study, come and visit our posters. Thank you.
I'm presenting a study on food consumption among school children conducted right here in the city of Accra. In this study, we make two key findings. The first one is that socioeconomic status is very important for food security, food consumption, and dietary diversity. And we see that children from poorer backgrounds suffer or face inadequate access to food. However, our second finding shows that consumption of packaged and processed foods, such as soft drinks, tends to cut across wealth groups. So what does it mean? It means that the urban food security question today is defined not only by urban poverty, but also by inequality and dietary change. What needs to be done? Well, we need agri-food and trade policies that create food environments that provide urban consumers. Thank you.
Sometimes I wonder why there's duality of event. First, there's high level of malnutrition, and the other side, there's local biodiversity. This study was carried out in Kenya, and we used a former business school model by a project implemented by SCAR and Jeff, and the results was increase in consumption, increase in production, and increase in technology gardening uptake. These results was then used to convince the policymakers to develop the first ever biodiversity policy in Kenya, that is Busia County, to update the food composition table in Kenya, and also to develop a recipe book. To know more how policy is done, please come to poster number 47.
Agricultural projects, intervention projects has been a vehicle being used by government and development partners to convey desirable change to the people and to the vulnerable groups. But the delivery of these project outcomes, impact, are being constrained by a lot of constraints. What are they? Please come to poster 42 for more discussions and answers. Thank you.
Food preference checklists are not commonly used in low and middle income countries. We developed a food preference checklist for use in Malawi. It contains 130 items from the Malawi food composition table, plus additions of packaged foods. As you can see from the slide, it's a 5-point hedonic scale, but also has a possibility for women who have never eaten a certain food. We tested this in 240 overweight and normal weight women in urban and rural areas in Malawi. It's part of a Drivers of Food Choice project conducted by RTI, University of Malawi, and Harvard University. For more information about the results, please come to poster 21.
Commercialization and food and nutrition security in Myanmar. We used a review of state of play on the agriculture transition, and we did an analysis of agriculture life stories. And what we found was farmer sense-making and decision-making processes differed substantially when considering agriculture engagement and their food and nutrition security. Common strategies among successful farmers was either to buy or produce organic foods for their personal household consumption and use chemical inputs for their agricultural businesses. So, if you want to know more, please visit poster 67.
August 2017, we and a team of our colleagues explored the approaches and lessons learned from 3 very different agriculture and food security activities that have reported improvements in nutrition outcomes. And the first one was MAWA. It's a food security activity led by CRS. The second one is RAIN, led by Concern Worldwide. And the third is a Feed the Future Value Chain Markets Facilitation Project, Profit Plus, led by ACDI VOCA. They're different in their kinds of direct beneficiaries they targeted, the selection and delivery of their interventions, funding sizes and sources, and the position of nutrition in the objectives. So start by poster 37 to learn our findings and recommendations for USAID Zambia mission for their future program design. Thank you.
ISA2's Amana Fellowship focuses on social networks in
in Burkina Faso, and in her project measured how diffusion of knowledge, specifically around agriculture, nutrition, and health, differed based on the types of social groups that were used as the conduit. These social groups were divided into 3 types: agricultural, health-related, and family. And she used difference in difference estimation to see how well this knowledge was taken up. ISA2's poster will show you how these manifest into 3 main findings on who, what, and how the ag, nutrition, and health messages were best conveyed, and leaves us with strong policy implications for behavior change communication, specifically for the West African context. ISA2's poster is number 68. I invite you to all take a look. Thanks so much.